When performing a slide board transfer, have the proper equipment ready and a plan prepared. Explain the transfer and the objective to the patient. Place and lock the wheelchair at a slight angle to the bedside, removing the armrest and leg rest of the wheelchair near the bed. Set the bed at a level slightly higher than the wheelchair and apply a gait belt to the patient for safety precaution. Instruct the patient to lean to the side, lifting hip off the bed. Slide the transfer board underneath the ischial tuberosity, aiming the board into the seat of the wheelchair. Position yourself in front of the patient with a wide base of support, flexing hips and knees. Be prepared to block the patient's knee with your knee to prevent anterior slide. Grasp the gait belt to support the patient and have them lean towards the wheelchair. Instruct proper hand and finger placement to prevent the patient from pinching fingers underneath the transfer board and to allow room for the hips to slide down. On the count of 3, have the patient push down through both hands, lifting the hips and thighs across the board. Repeat this motion until the patient is safely secured in the wheelchair. Remove the slide board and adjust the sitting position as needed for comfort and safety. Replace the wheelchair armrest and leg rest. This transfer can also be done with 2 people, with the second therapist providing support from behind during the transfer. A transfer from the wheelchair to the bed would use the same procedures. Place the wheelchair at a slight angle to the bed, locking the wheels and removing the armrest and leg rest at the bedside. The bed should be set at an equal height to the wheelchair if possible to make an easier transfer. Use the same body mechanics, precautions, and instructions with the patient as with a bed to wheelchair transfer. The transfer from the wheelchair to bed may require more assistance since the transfer board will not be at a decline. Make sure the patient is comfortable and seated safely on the bed, and remove all equipment before leaving the patient.